patients do you see in your practice?
Okay, I have the woman in her late 30s walking through the doors, can't sleep, having anxiety or panic attacks, mood swings, depression, mid-abdominal weight gain, heavier bleeding, a real loss of control of their life.
Okay.
And usually these are women who have already tried one or two other things. They've either already been on Xanax and Prozac, they've been on things to try to control their bleeding. Nobody's really looked carefully at their hormones. People don't expect women in their late 30s to start having hormonal issues, but we know quite well that hormonal decline actually starts in the mid-30s. So
is that called premenopause?
That is.
It's
a fallacy because people think of perimenopause as being very close to that age 50 and just the years centering around that. But it actually turns out that our hormones start to decline in the mid-30s. So obviously we have a lot of symptoms in the mid-30s that are missed. People don't look at them as hormonal deficiency symptoms. And I get everything from the woman who is on that path and has realized that the traditional medical model is not answering her quest. And she is indeed on a quest for something which she knows is out there before she walks through my door. There's no question about that. I get everything from that to a woman who is in clear menopause and just has decided that she doesn't want synthetic hormones and she wants to use a more natural or bioidentical source. Now, obviously, these women, one would think, are coming from particular walks of life, but actually I have women coming from all walks of life, from the person who works in the grocery store to the CEO of a major company. It is from all walks of life that people walk through the door because they realize that there's actually something better out there for them.
Do they feel that much better? I mean, the women, I mean, you see these transformations, obviously.
Yeah, they feel a lot better. I really have had, usually as we start hormonal therapy, especially when we're starting progesterone, women will start to sleep and have less anxiety and be much calmer within a week.
Really?
I very, very frequently get either an email or a phone call within that first week, and just unprompted, to tell me that they already feel better.
Okay.
For hot flashes and so on, we usually start to see results around the second to third week. If we're treating thyroid, we start to see increased mental clarity and better metabolism within the fourth to fifth week, and they notice it. And they come in with a better sex drive or a better... That's another issue, actually, I didn't mention, but sex drive is one of the... Sex drive, fatigue, and weight gain are probably the number 1, 2, and 3 complaints that we have coming through the door.
But isn't that just part of getting older? You reach your 40s and you start to lose those things. I mean, couldn't somebody argue that?
So somebody could argue that, and actually, you know, if there are clearly two different medical models here. There is the medical standard, which treats symptoms, a symptom-based approach, and treats disease as it comes up.
Okay.
But my belief is that when we know that the human lifespan expands beyond age 50, and our organs really don't function optimally after age 40. So in my opinion, it's absolutely reasonable to have a proactive approach to rebalancing the items in the body that are out of balance so that your body can do what it does best, which is prevent disease.
So not all physicians, though, are approaching bioidentical hormone replacement the same way. Is that
I think that's
right?
a fair statement.
And what are the differences?
The differences would be that we do rigorous testing of actual hormone levels,
Okay.
the actual nutritional levels, which interestingly enough, the best nutrition test you can get is covered by most PPOs. So that's a nice little benefit. And testing for toxicities of the bowel and liver. One of the things I found when I only did hormones, which I actually did for many years before integrating these last two little pieces into it.
Because I know there are a lot of doctors that are just doing hormones.
And
you say it's a mistake?
What I found is you hit a brick wall very often, because let me give you an example.
Okay.
You're replacing someone's thyroid, right? And you get the thyroid level to where you think it should be. And the person is still tired and fatigued and depressed and lack of mental clarity, gaining weight, regardless of eating nothing and exercising till they're blue in the face. And you realize real clearly that you're missing the picture. The thyroid hormone isn't the entire picture. Then you start to look at the biochemistry and you realize that you need zinc and selenium and iodine and B12 to actually activate that thyroid. And then you look a little bit further into the toxicity arena and realize that the bowel has to be free of gastritis in order to absorb B12, and the liver has to be activated to convert inactive thyroid to active thyroid. So all of a sudden, and if your mind is stressed, that's a major thyroid inhibitor. So if you don't look, it is complex, but if you really don't, if you don't look at all 5 things, and you can,
so you put this together for them, though.
Yes, 100%. We do the testing and then individualize the treatment plans based upon what people choose and what people want.
You said to me you don't really have set protocols. What does that mean?
That simply means that there is no cookie-cutter approach to this. There's a real art to medicine. I think that's one thing that we've lost along the way when we really look and always are talking about evidence-based medicine. There's evidence-based medicine, and added to that, to be a good practitioner, you have to add the art of clinical judgment. Okay. And that art comes from spending a lot of time with your patients and doing a thorough analysis and taking every single symptom seriously. Because how many patients walk through the door and say, well, I have a headache and my neurologist did all these tests and I'm completely fine, but I still have a headache.
Okay.
My CT's negative, my everything's negative. And I think that, you really have to spend time listening to what your patient is telling you, putting it together with the best information that you can get diagnostically, doing a clinical exam, and then you've got the full picture.
Do you believe, and I read Suzanne Somers' book, anticipating this interview.
Good for you.
Do you believe the second half of life, as she says, can be the best half? Which I think is a bit of an exaggeration. Do you see women feeling better after 50?
I actually am of that same belief, simply because the first half of life is very, we spend a lot of time on what we're going to be, who we're going to marry, the children, working all those things out. And that's the mental stress that actually brings a lot of stress into our health and our body. In the second part of life, we've sort of grown up. We've learned to accept a lot of things, let a lot of stuff slide off our shoulders, and just take it a lot easier. And if you look at the eastern part of the world, you realize that those people who are standing there on one leg and really have strengthened their mind and their body, their health is much better than it was before. And I think that it's our social training to think that you get after 40 and you're going down the hill.
Doesn't have to be that
I actually think that you get after 40 and you could be going up the hill, because the mind drives it all. And if you are powerful in mind and spirit, you can make yourself powerful in body.
We're going to take a quick break. We come back. I want to ask you about the commonly replaced hormones, what they're responsible for, and what people can expect. You're watching The Wellness Hour, the leader in medical news and information.